Welcome to the Center for Communication Disorders here at Rocky Mountain University of Health Professions. I'm Wendy Chase. I'm the Director of Clinical Education. I'd like to invite you to see some of the things that are happening here in our clinic as we strive for exemplary patient care and high-quality clinical education.
Here in Utah, particularly in Utah County, we have a very large pediatric population. There are not enough services to meet the needs of all of the children who have those needs.
We've been trying to find a speech therapist in Utah that was familiar with the device my son was using as his augmentative device, and we've had a really hard time finding someone that was familiar with it because it's not the go-to device for Utah in the special education segment.
The graduate students here in our clinic have great opportunities to hone their clinical skills here with supervision in the clinic in order to be able to provide a service that's very comprehensive and very individualized to the needs of the families that we're working with.
What makes Rocky Mountain University stand out over other places, I feel, is I actually love that it's a university, and I actually love that it's a student with Rome, because they are so invested. This is their degree. So I feel that they put a lot more time and effort into Rome as an individual.
Yeah, we spend a lot of time working together in small groups or all together, learning from each other.
And yes, I have my supervisors and they'll help me along the way, but they let me explore. They let me try things my own way. Maybe things that they haven't thought of or things that I need to learn from my own experience.
When we think about people who have had strokes, we usually think about the older population, those who have more access to third-party payers, but there is a substantial number in our community who have had head injuries from snowboarding accidents or have had stroke secondary to cardiovascular disease that has resulted in a communication or a cognitive or a language impairment of some sort. Many of them are uninsured or underinsured or have to go through the struggles of fighting a third-party payer to get the services that they need to be able to communicate with their mother, with their father, with their daughter.
My family. I want to talk so that they can hear me.
If anyone is interested in Rocky Mountain, I would highly suggest it. I mean, it's somewhat rare these days to get something that's of quality, let alone for free or at a low cost. And usually if you do that, it's through kind of maybe a government-sponsored program. You almost feel like you don't want to do that because there's so much work behind it, where here it's been super easy.
Using state-of-the-art equipment while actively learning evidence-based clinical care practices, students begin changing lives just weeks after school begins by working in Rocky Mountain University's speech clinic. By doing so, the Center for Communication Disorders actively accomplishes Rocky Mountain University of Health Professions' core value of service. Whether you're a prospective student or a potential patient, call us at Rocky Mountain University and see for yourself how we significantly improve the quality of life for the most vulnerable children and adults in our community each day.